How's it going, everybody? This is Dr. Tim Augustyniak here with the Freedom to Flourish podcast. Our episode today, we're going to be talking about how to raise healthy kids. We're going to start from all the way before they're even born with pregnancy, and then through early childhood. And we're just going to talk about a lot of different things that we see, a lot of things that we encourage health-wise, and what things you can do as a parent to make sure that your kids have the best odds of being healthy as possible. So really looking forward to it. It's going to be a good time. Lots of really good information today, and lots of things that might light up some light bulbs for you and really give you some great ideas. So anyway, Dr. Joel, how you doing today?
Hey, awesome. Doing well. Glad to be here, and it's good to see you, of course. And to our listener, we talked about this a little bit, but we have to preface this episode and the next one as well as we'll get into talking more about the most common like pediatric health issues that we see. Talking about ADD, ADHD, allergies, constipation, immune system issues, all the things. We have to preface all that by saying, full disclosure, neither of us, we don't have kids, but a lot of what we're going to be talking about is primarily from our clinical experience working with pediatric patients, kids that come in that have issues with focus and they're just over facilitated. They're just extremely excitatory, like ADHD type excitatory, kids that have immune system issues. They always get sick. They're constipated. They can never go to the bathroom, skin issues. They can't sleep, all these different things. So, but it really starts with, when we talk about health and children's health, it really starts with pregnancy and, in a lot of regards, the health of the mom. So Dr. Tim, conception happens. What kind of things come to mind, when we talk about like the health of the mom that you might spend time talking about with pregnant patients that you're working with?
Yeah, the first thing that comes to mind is ensuring that essentially you're as chill as possible, where we always talk about this balance between sympathetic and parasympathetic and sympathetic dominance and all those things. And we always get on our soapbox about blood sugar and how that negatively impacts everything from stress levels to neurotransmitter production, liver detoxification, just proper nutrients for a lot of different functions. And it's something that needs to be considered everywhere in health. And so, especially when you're pregnant, for the sake of the pregnancy or your baby at that point, we need to make sure that one, you're eating properly to regulate blood sugar, but then also that you're taking measures to make sure that stress is at least as minimal as it can possibly be. And if you've got other little kids running around or work is busy and all that stuff, I totally get it. Life gets that way, but there are things that you can do to ensure that you're not overly sympathetic dominant. Um, at least with my education and things that I've learned through my functional medicine as well as applied kinesiology training. There is correlations between high stress levels in mothers when they're pregnant with their children and the babies being born and then eventually getting anxiety, stress, and being more prone to those things
Mm.
uh, in their life. And so a lot of what we kind of have to think about in this idea of, okay, how do you raise healthy kids, you have to start them off right, and you have to keep in mind that anything that you're putting into your body or putting your body through, it's going to reflect on that child, unfortunately. And so it's not like it's two separate entities at that point. Anything that you ingest or anything that your body has to process, their body has to deal with too. And so sympathetic dominance is one of the biggest things that we really have to consider, where it's one of the easiest things to fix, but then again, it's also one of the most difficult ones to fix because it's not always so simple all the time. You got the emotional stuff, the diet stuff, and then with pregnancy, there's lots of emotions and hormones and cravings, all those things. But if you see the light at the end of the tunnel of a really healthy child, hopefully that'll help keep things as smooth as they can and keep you on track. So at least for
Mm-hmm.
first things first, sympathetic dominance is one of the biggest things. And then beyond that, just making sure that you're supplementing with some good prenatals, things like that. I know Thorne carries a pretty good basic prenatal that has all of the bioactive forms of folic acid and all those things. So then that way you can actually use those nutrients. And then from there, other things like essential fatty acids, fish oil, lots of good animal fats. All those things are phenomenal for nerve development. So, brain, spinal cord, all those things that are required for sufficient development as in the womb, as well as once the baby's born. So, all those things kind of fall into that category of really big hitter things that you should do during pregnancy. Um,
Mhm.
I'm sure there's plenty other things. So I'll just kind of leave it at that. And then Dr. Joel, what are your thoughts?
Yeah, for sure. I mean, our list here is not always the 100%, comprehensive, but definitely the top numbers there. And I would argue too, even, when we talk about the quality of the pregnancy, the quality of the birth, I would say a lot of it starts even before conception. It starts before people get pregnant. And, to the mom that's or to the future mom that's planning on getting pregnant or even is pregnant now, I would strongly recommend take your health very serious and consider working with a functional medicine doctor. Consider working on your nutrition and just trying to learn more about that, learn how to become healthier through that, learn how to become healthier through movement, and of course all the other things we talk about when it comes to health, like good emotional health, having peace, having gratitude, all these different things. And so I know that there's a lot of women that, will come in, they're pregnant, and they'll have different issues flare up. And a lot of the issues they either had significant before and then pregnancy, for whatever reason, just made it worse. Or they had like a minimal issue before they got pregnant, and then they got pregnant, and then that made things worse. And it just adds to the pregnancy challenges, it just adds to the difficulty, and then just puts more stress on things overall. So I would say if you got some kind of health issues, whether it's issues with chronic infections, fatigue, digestive issues, food sensitivities, I would say really try to address those things so that you can become as healthy as possible. And from the women that I've worked with that have gone through that approach, Dr. Tim, those women always fit, and their pregnancy.
Sorry about that, everybody. It seems like Dr. Joel's signal was kind of going funny. But
Yeah, it just totally cut out on me. Sorry about that.
yeah, so we're back at resuming talking about just healthy mothers during pregnancy. One of the big things that I think is really important to discuss is I know you were just saying to take your health really seriously. Um, a healthier mother equals a healthier child. We already kind of touched on that. But one thing that we didn't really touch about is like exercise habits and all those
Hmm.
things where, as things progress, it becomes more and more uncomfortable to exercise. And I just want to emphasize the importance of exercising leading up to pregnancy, or at
Hmm.
least as soon as you realize that you are pregnant, really taking that seriously. So then that way you're in physically fit and good shape to carry a child and then give birth and everything. So, um, just wanted to touch on that a little bit.
Yeah.
That can never hurt, the last thing that your body wants is for you to sit around and do nothing while you're carrying a child. It doesn't
Right.
want that even when you're not, but just for the sake of getting those good habits in and making sure energy stays up and all sorts of inflammation and all that stuff can clear out through exercise. It's a really great thing to do. So um,
Yeah, for sure. And
and
I would say I would definitely emphasize what you said, Dr. Tim, on exercising before you get pregnant so that your body is in a good shape with that. Because there is, a case where um, essentially if you were to get pregnant and then you start exercising a ton, I could see an environment where you increase cortisol super high, and then that can throw off some of the hormones and just make things a little more difficult. So definitely you want to have that going into the pregnancy, I would say. And then, Dr. Tim, that's such a good point, because the overall, the majority of women that I've seen that have been physically active, like doing workouts throughout their pregnancy, they always recover so much faster than other women that don't work out kind of throughout their pregnancy. And so, when we talk about workouts, to the listener, that could be just walking, a lot every day. It could be doing different kettlebell workouts, could be lifting a little bit. I think all those things are really, really good things. It could even be running as well, although that's one that I wouldn't recommend pushing super, super hard because of the whole cortisol piece. So, but yeah, Dr. Tim, that's really, really important. Let's see. So yeah, we've got the pregnancy now. Dr. Tim, a lot of the times I'll have patients coming in that are pregnant that are just kind of wanting to get some maintenance, kind of get adjusted, kind of be checked out for nutrient deficiencies and things like that. I think obviously those are great ideas. And I know a lot of women that have already stepped into the natural health world of things with pregnancy. A lot of them do like to get adjusted, even up close to birth. Sometimes even as they are either really getting close to labor or in labor even, because when you have a balanced pelvis, it's going to just improve the overall quality of the birth process significantly. Dr. Tim, you probably have a little bit of a similar experience, just seeing a lot of women just kind of wanting to maintain good fascial balance and so forth, leading up to pregnancy. Do you see, is there anything there specifically that you want to kind of share with the listener in your experience there?
Not especially. I mean, it's just as simple as the more that your body is able to move properly without pain and everything, the better that it will operate during pregnancy and during birth. So, um, I've seen plenty of women who come in pre-pregnancy, during, as well as I've seen some women that are post miscarriage and everything that they're like, okay, something's not quite right. Need to
Right.
make sure that everything's healthy. So that's kind of like a little bit of a kick in the butt to get things right, to make sure that the next time they try, things are good to go. So
Yep, for sure, for sure. So let's keep it focused on the kids here. So we've got healthy mom going into the healthy pregnancy. Let's talk about birth a little bit because that's super important. I know a lot of kids can develop different health issues based on simply just the birth. And obviously, you know, the quality of the mom's health and sympathetic versus parasympathetic balance is going to be huge with the whole birthing process. If it's going to be a long, difficult labor, or if it's going to be nice, easy, and smooth. Um, when it comes to birth, Dr. Tim, I think you and I are both going to recommend trying not to use different drugs, different chemicals, and things like that for the whole birthing process. Try to do it as natural as possible. And then at the same time, I think, you know, we would both probably agree that if you can get in contact with a midwife and work with a midwife throughout the whole birthing process, that's going to provide just a really great natural option to having a child that is going to save a lot of stress on your system. It's going to save a lot of stress on your baby, and it's going to help the birthing process overall be much, much more natural and holistic with things. Dr. Tim, I know that there are a lot of different options as far as the birthing process goes. I mean, you know, obviously you can go to the hospital, you can have a baby there, you can have a home birth, which there's kind of different ways you can do that as far as what labor and all that looks like. But then you can also there's kind of a kind of hybrid option, right? In hospitals. I don't know if this is in all hospitals, but I do know in a decent amount of them you can do this. And I know that I've had patients that have done this where essentially you have, you know, your own private kind of section, your midwife is kind of working through the birthing process there with you. And if something were to go wrong, you can go down the hall and you can be seen by a medical expert there to help with things. And so for what I've seen, at least, Dr. Tim, in my experience with patients, the crunchy moms and dads will generally go for the home birth with the midwives. And it generally goes really, really well. Generally goes really, really well. Everybody's happy, healthy. It's at home. It's more comfortable. It's more natural. But then I know that for some of the newer parents, they're a little bit nervous with their first child. They like to kind of have it in the hospital setting, maybe working with the midwife there, kind of in that hybrid unit and so forth. But Dr. Tim, what kind of, do you have any other experience from working with pregnant women as far as that birthing process? Like any tips that you'd love to share with that can really help these moms have as healthy babies as possible?
not especially. You know, you kind of touched on all the things that I would touch on. One thing that
Right.
I thought was a good thing to bring up, at least at this point, is so the reason that we're kind of on that side of things isn't necessarily because, you know, we totally want somebody to be in a quote unsafe environment to give birth and all those things. But at least within the the medical setting of things, if you look at things such as C-section rates over the
Right.
last however long time frame, where as epidurals are given earlier and earlier during the labor process, the rates of C-sections actually go through the roof.
Yeah.
And unfortunately, from looking at things, and at least within my training and the research that it was kind of based on, it's the earlier that you give the epidurals, the more likelihood that there's going to be a C-section, and that's just going up over time.
Wow.
Epidurals are given earlier and earlier throughout that process, just for the sake of comfort for the mother giving birth. But unfortunately, that's just a part of the process. I understand that there's a time and a place for it and everything, and we have modern medicine for a reason. But I think I kind of want to reflect on one thing that you had mentioned there, where a lot of the women who opt to do this with the home births, they're the crunchy or the really holistic moms. I think the reason that things go well with them usually is the fact that they are so dialed in on their health leading up to
Yeah.
pregnancy, throughout
Right.
pregnancy, exercising and getting care, so then that way their pregnancy and birth goes smoothly. And then
Yeah.
once the birth comes around, it's it's just like clockwork. It just goes as it should. When things don't go as they should, very often it's because things aren't able to communicate properly because of things like epidurals and all that stuff, or it's
Right.
just you didn't take care of yourself along the way. There's
Right.
of course there's exceptions to every rule. I don't want everybody to listen and say, "Oh yeah, we don't know anything that what we're talking about," and
Right.
you can do everything right and still have things go wrong. So
Right.
um,
Right.
it's not across the board. I really want to emphasize that. Um,
Yeah, that's good.
but yeah, I think that's about the best that we can do as far as talking about that without any experience. We can just talk on our training, and
Sure.
then
Sure.
yeah, I think that covers it pretty well, in my opinion.
Yeah.
It takes us on
Absolutely.
to our next point, which we're going to get into things like breastfeeding, as well as care of the baby. So, do you want to start
Yeah.
chatting about that a little bit?
Yeah, for sure. Well, one thing I want to emphasize too that you mentioned was the importance of really having a vaginal birth. When the baby goes through the vaginal canal, it's being exposed to its first kind of microbiome environment. So it's being exposed to a lot of different bacteria and so forth, and that's good for the baby because essentially that's the first step of the baby developing its own microbiome, its own gut health, having diversity, and so forth. So being able to go through that vaginal canal is really important for the baby's gut health, immune system, and everything. So you'd mentioned that. I want to touch on that just a little bit and expand on that because it's really, really important. And then, of course, once the baby's born, right, there's a few things that I would encourage moms and just from, again, working with patients and seeing what seems to work best. Dr. Tim, we could talk about this topic for a minute, but the baby's food, breastfeeding is going to be by far the best thing for the baby. And avoiding toxic formulas is going to be also extremely important. Dr. Tim, I don't know about you, but I whenever I'm at the store and I've seen like the baby formulas and you look in there at the ingredients, holy smokes, it's a hot stinking mess in those ingredients. Baby formula is some of the most toxic stuff that I wouldn't even recommend adults take. Those are the types of ingredients in there, like all the inflammatory seed oils, all of the different just processed nutrients. Um, a lot of times, if you look at the vitamins and minerals, by the way, and you see something that says D-alpha tocopherol, so that's vitamin E. If it says DL, DL alpha tocopherol, that's a synthetic vitamin E, which is extremely toxic to the body. But if you want to look at like the vitamins and minerals in a supplement or something like the processed foods and formulas for babies, that's a really good indicator to see if this is actually a quality substance or not, a quality nutrient. So, but yeah, so many toxic formulas, Dr. Tim, and a lot of kids when they're born, pretty quickly they start developing issues. They'll start developing issues with skin, with digestive issues, with not feeding well. And Dr. Tim, personally, my thoughts on things, just working with a lot of patients, a lot of newborns, is it comes back to what are they eating? What is the mom eating? And also vaccines, which are can be very disruptive to the system. So, Dr. Tim, what about you? What kind of things do you think about when it comes to like breastfeeding, overall nutrition and formula for the baby that really is, really, really important that moms and dads should be thinking about?
Yeah, my tip is always breastfeed as long as you can, at least until the kid is able to eat his or her own food,
Right.
um, good quality stuff. But if you are forced to do something like formula, do exceptional research on what exactly you're going to do. I know
Right.
there's a lot of controversy around things like raw milk, stuff like that. Um, but I have heard of women doing that because they
Mhm.
just don't want to deal with formula. The problem with formula is, there's so many ingredients that aren't necessarily listed. And I've read quite a bit of research that a lot of them have metals in them
Wow.
that aren't listed on the label. And so,
Wow.
I mean, most of them are not from the United States. They're not produced here.
Yeah.
The ingredients, everything's produced somewhere else and then shipped over here and has our, formatted labels, our language on it, everything like that. And so, I mean, if you can think of where your food comes from, if you go to a local farmer's market, you talk to the actual farmer, shake their hand, buy their product, you know where that's coming from, and you can have a
Right.
face-to-face conversation about what's in it. If you have some baby formula that's produced in some country, somewhere, God knows where, gets shipped over here on a big tanker, just covered in shipping containers and everything. I have to say I'd much rather trust the things that are coming from, say, a farmer's market where you can actually meet people in person. It just doesn't at least make me feel good knowing that it comes from overseas.
Right.
And there's a lot of things that, although we can think that it's regulated, I think it would be a little naive to think that everything is as strict as it can be with all the crap that's in food as is. All the
Yeah.
lawsuits around glyphosate and
Right.
all these chemicals and weed killers in food. I just don't trust it with all the research that I've read as well.
Yep.
Um, so there's that component with the formula, but then, like I said, breastfeed as long as you can. So that's
Yep.
just another input to the mother to say, okay, try to be as healthy as you can yourself. You need to ensure that you're not just putting, all of your effort into your child. Not that that's a bad thing, but you need to take care of yourself as well, because if
Right.
your child is relying on you for their food, their nourishment, and their nutrition, you need to make sure that you're healthy as well. There's a lot of instances of where a baby gets colic because there's something just not quite right with the mother's milk. And so lots of issues with the mother's health can lead to downstream issues where the baby just doesn't want to eat. They can force them, not to latch and actually, drink the milk. And then from
Right.
there, they, formula or something else, which can be detrimental at that point. Um, Very important things that get passed from the mother as far as it goes for immune system development for the kid, um, really good immune cytokines that help build up the immune system, and like you said, the microbiome, all that stuff is super important.
Mhm.
Um, but it takes actually having that transfer there where breastfeeding is necessary. So
Right.
um,
Right. Right.
now I guess onto you kind of mentioned vaccines as well. So one thing that I kind of want to talk about, I already touched on metals of formula, diapers. We have diapers on the list. So um, diapers. Diapers have a lot of microplastics. I've also read some research that diapers also have metals in them.
Yikes.
Reason that I think it's so important to mention on all that stuff, it seems like I'm harping on metals specifically a lot. I see metals like crazy when it comes to kids with eczema and other immune hypersensitivity types of things.
Right.
It's gut and then it's metals.
Right.
So if you clean up the gut and you help chelate metals out of there, or just don't expose them to them in the first place, a lot of times those things go away pretty dang quickly, especially in
Yeah.
kids. So, I mean, if there's metals in formula, if there's metals in baby diapers, if there's metals in vaccines, I mean, those are three things that you are just exposed to like crazy early on in life. And
Yeah.
so, there's one thing that you can do to stack the odds in your child's favor. It's breastfeed, use cloth or organic diapers. I know cloth can be, inconvenient and gross, but for the sake of the health of your child, if it really is a legit thing where you have a history of health issues, your family has health issues, and you want to kind of break that cycle, it's something you can kind of work with.
Yeah.
But then, on the topic of vaccines are full of metals. They are suspended um, in the fluid and everything that does contain metals as a preservative. And so, if you look at the vaccine schedule from say like the 80s versus what it is now, it's like 4 or 5 times what it was back then. And for what? Some things that aren't necessarily prevalent and around as much nowadays. There's a lot of debate that goes around the topic of vaccines, but at least with opinions totally aside, vaccines are going to introduce a lot of inflammation. They're going to shoot Th2 immunity through the roof,
Yep.
um, and they're going to throw things out of balance very early on in life. And so, if you kind of reflect back to our episode where we really got into the immune system and how there's the Th1s and Th2s, most health issues, I would say, arise from there being imbalance where there's Th2 dominance. You have all these things pushing that side up, and that's inflammatory things such as vaccines or gut issues, metals, mold toxicity, you name it, parasites, allergies, all those things ramp that side up. And then you have your Th1 side, which is geared to fighting off infections, which goes down when Th2s are up. And the only thing that suppresses this is stress, as well as the Th2s being elevated. So many different things are rooted in that problem. Well, if you're skewing the immune system so early on in life, it's not going to stack the odds in your child's favor. And so,
Yeah.
even if you're not really comfortable with not vaccinating your children, spread them out potentially. You don't need to be just swarming the immune system with all these things right within however many months of birth, especially when the immune system is developing at such a high rate and is just so sensitive.
Yeah.
We always, I always joke around and say little kids in kindergarten or daycare are like petri dishes because they just bring all the garbage home with them because they're always
Right.
sick. Well, unfortunately, and fortunately, it is a necessary component of development of the immune system. You need to learn how to fight things off. Your immune system needs to develop antibodies to colds and all the little bugs that go around.
Right.
And when that's the case, you need a Th1 response to fight those things off. If you're dampened down with metals, if you're dampened down with vaccines, and all sorts of things that can drive the Th2s, you're not going to ramp as much of an attack. And that's where kids can develop these chronic ear infections or chronic sinus issues or asthma, all these things where it's just a result of the immune system being bombarded with too many things early on in life
Yeah.
that normally should not be there. Asthma's going up, C-sections, autism,
Skin issues.
ADHD, ADD. All these things that you're hearing more and more and more about it with kids. And the question is
Right.
why? And there's quite a bit of research to indicate that it's all the things we've kind of talked about. Not to say that it's just exclusive to that, but if it's easy enough things to fix and prevent, why would we not do that? At least
Yep.
in the future with my kids, it's something that we're going to be very diligent with. But with most of the parents and patients that come into my office, it's something that they want to do as well. Because if it's controllable, why would you not? Let the genetics and things that you can't control be the issues and the things that
Hmm.
drive issues.
Yeah.
Fix the things that you can.
Yeah. Man, there's so much on that topic, and it's a really important topic to talk about because I would argue, and I mentioned this a little bit earlier, but the majority of issues that I see that kids have is literally from this imbalanced immune system issue because of the vaccines. And the purpose behind the vaccines is like we're going to expose your body to a little bit of this substance, a little bit of this infection. Your body's going to produce antibodies. And from that, then next time you're actually around that, you're not going to get sick. Okay, that makes sense. Logically, it just makes sense. The problem is how it all comes together results in a lot of issues. And specifically, I know Robert Kennedy Jr. talks about this quite a bit as he talks about vaccines and he talks about his experience working with different doctors and so forth. And of course, he talks quite a bit about mercury toxicity and thimerosal and all these things. But essentially, when we think about vaccines, we have to understand that very early on in a lot of the development of these different vaccines, if you were to put some kind of dead virus or something into your system, a lot of times the body wouldn't produce very much of an immune response. And so it wasn't very effective. And what researchers and scientists started doing was and these manufacturers, they started finding different chemicals, which are called adjuvants, and they started adding those to these shots. And now, as what the purpose of adjuvants is to create this increased inflammatory response from the immune system, so that the immune system will create more antibodies to the virus and whatever infectious agents in the shot. The problem is the adjuvants are ridiculously toxic and should never be in our children. And so that's kind of piggybacking on some of the things that you mentioned there, but the adjuvants are extremely important. Adjuvants, you look up, if you look up vaccine receipts and you look up essentially the ingredient list on those, it can be tricky to find. Sometimes you have to look a little bit deep, but a lot of times you'll find different things like different metals. You'll find aluminum, you might find mercury, you might find something called polysorbates, which are essentially a chemical that actually breaks down the barrier between your blood and your brain, the blood-brain barrier. And that's obviously never a good thing. But there's just a number of chemicals in there that cause issues. So Dr. Tim, I'm so glad that you went into that. And I think really for the listener, I think kind of where our stance is, it's like there's this risk of, okay, well, if you don't get the vaccines, then, you're maybe more likely to get sick and all these things. And I would say, number one, the adjuvants are going to be extremely toxic to your body. It's not worth that. And number two, if you can focus on good nutrition, good movement, being outside, all the things that we talk about in regards to health, kids are, number one, their immune system is going to be really strong. Number two, even if they do get sick, some basic support with vitamin D, maybe elderberry, things like that can help them get over that very, very quickly and help them to just have a solid immune system. I think those are kind of the main things I wanted to mention there, Dr. Tim. There was something else, and I think the last thing I just want to say on that topic is, a lot of kids, we refer to the whole petri dish thing. A lot of kids get sick and they bring back sicknesses. I would argue that a lot of kids get sick because I would say, number one, it's not normal that kids get sick like that as much as they do today. And then I would argue, number two, they get sick because their immune system is a hot mess. Just like you had mentioned, the whole Th1, Th2 imbalance. And what I've noticed working with kids is when we address things and we actually get their immune system balanced, like they go to daycare, they go to school, they come back and they're not getting sick. They just have a strong immune system. So I would encourage parents and our listeners that it's not normal for kids to get sick so often. They should have a stronger immune system, and there's a lot that we can do about it. Dr. Tim, any thoughts to add to that there?
Last bit I want to add, it might sound like we're 100% opposed to these things. And, for us and our families in the future, that may be the case. But I want to emphasize to our listeners that although that's our opinions on things, we happily meet people where they're at. So if a patient comes in, they're like, okay, I want my kids to get these vaccines, or wherever you're happy with it. If you're going to spread them out, whatever it is, we're always happy to work with people to help them mitigate the effects that are going on with things.
Right.
And so, like I said, it ramps that Th2 response. Well, we can help you get your kid out of that Th2 response. If it's something that you feel that's the right decision to get those shots, but you want to go about it naturally to help mitigate the negative effects while getting the positive effects of the vaccine, and that's something that we're totally on board with. It's everybody has their own decision with their health. And there's things that you can do to mitigate the effects as much as you can.
Yep.
But then also on the flip side, there's things that you can do to where hopefully you won't even need them in the first place. So it's just a matter of your choice as a parent and what you feel is best, and doing right by what you think is the best decision or for your kid. So
yeah, absolutely. And so patients that ask me and say, hey, they really feel convicted that this is the best choice for the kids to have them get vaccinated in whatever way that looks. I say that's totally fine. I say essentially what I recommend those patients do is that they make sure their kids are getting vitamin D before they get the shots. obviously during, and then usually for 1 to 2 weeks after. And then you're not going to do a small amount of vitamin D, like, 400 IU or something like that. You're going to want to do somewhere, again, depending on the age of the kid, somewhere around 4,000 IU vitamin D per day. And what we found is that really, really supports their immune system in battling some of these different imbalances and so forth. I would say vitamin D is one to look into. I would say another really common one that's needed is something called resveratrol. Resveratrol is often needed to help rebalance the immune system after different vaccines. So a couple of things there for the listener that might be helpful. Dr. Tim, we've gone through a lot of good stuff here, right? Talking about just the mom's health, the importance of that, the birth, kids, and kind of starting to raise them up. We still have so much to talk about, right? As far as things go, nutrition. We've got to talk about some of the lifestyle things, the importance of spending time outside and grounding, limiting screen time. We've got a lot to talk about there. And then, of course, we still need to get into kind of the next section, which I think is going to be the most common issues that kids have with their health and essentially what causes it and how to fix those issues. But unfortunately, we got to wrap up today's episode here. So, Dr. Tim, anything else that you wanted to add before we wrap up here, and then tell the listener how they can find you?
That's it. I think we've talked enough for today. We'll just save some really good stuff for next time. Getting a lot of really good stuff. But anyway, I'm Dr. Tim Augustyniak. My practice is called Flourish Functional Wellness Center. I practice in Northwest Arkansas, Bentonville, Arkansas specifically. You can find me online at draugustiniak.com. I'm on Instagram, Facebook, X, or formerly known as Twitter, TikTok, YouTube, all the things. And then, if you guys have any suggestions for what types of topics we should cover, or even questions about what we do talk about, feel free to reach out. Also have all sorts of resources, such as articles, all that stuff, all over our websites. All kinds of health stuff. So feel free to reach out with any questions or suggestions, anything like that. Thanks for listening.
Yeah, for sure. And I'm Dr. Joel Miller, located here just outside Dallas, Texas. Here, the practice is called Freedom Health and Wellness. You can find me online at drjoelmiller.com. That's drjoelmiller.com. And then if you look me up on all the socials, you should be able to find me there. Guys, thanks for tuning in. This next one's going to be a lot of fun as well. Getting into nutrition for kids, getting into some lifestyle things, and then talking a lot about just the most common conditions kids deal with. So I'm excited. Thanks for listening. Thanks for the support, and we'll see you guys in the next one. Peace.